Bench2Bedside Fall Symposium. We're doing this in collaboration with Low Country in Mid-Carolina AHAC, Aiken, Denmark, and Orangeburg Calhoun Technical Colleges. Bench2Bedside strives to prepare students in South Carolina for a successful application to health professions training programs. We work with students from high school, technical, baccalaureate, and graduate levels. We are excited today to give you an opportunity to listen to 5 professionals talking about their careers. At the conclusion of each speaker, you will have a chance to ask questions. Please choose the raise hand option so that we can acknowledge and unmute you. The speakers will also share their contact information in the event that we run out of time or you have additional questions. Again, welcome to the symposium, and we encourage you to take advantage of this opportunity to gain insightful information about the careers we will explore. Now I will turn it over to Jalacy Green and Whitney Rojas, Low Country and Mid-Carolina Health Careers Program Coordinators. My name is Paula Jones, and I am the Director of the Health Careers Program with South Carolina AHAC. Enjoy.
Hello, everyone. I'm Jalacy Green, the Health Careers Program Coordinator for Low Country Area Health Education Center. And before we get started, I want to go over the objectives that the students should look forward to fulfilling this morning. At the conclusion of this activity, you should be able to network with practicing health professionals, discuss the work environments associated with the variety of health professionals, demonstrate basic skills associated with a variety of health professionals. And today, you are being provided an opportunity to network with professionals representing a variety of health careers. So your goal is to gather as much information to answer any questions that you have about the health professions represented in their role in the delivery of healthcare. Whitney Rojas, you want to introduce yourself?
Good morning, everyone. My name is Whitney Rojas, and I am the Health Careers Program Coordinator for Mid-Carolina AHAC. We are going to begin today with Professor Harris. Professor Harris is a medical billing and coding adjunct professor with Aiken Technical College. So Professor Harris, you can begin. Professor Harris is having some technical difficulties, so she's going to try calling in.
Good morning. Can everyone hear me?
Yes, we can hear you.
I am so sorry. I've been trying to log in on multiple computers, and I'm having tech issues. The links are not pulling up on either one of my computers. So my sincere apologies. But I'm ready to start if I'm able to.
Yes, ma'am, you can go ahead.
Okay. Well, good morning, everyone. Again, my apologies. My name is Tanira Harris. I'm a medical coding adjunct instructor at Aiken Tech. In addition, I am a team lead trauma analyst with the HCA Corporation over 6 facilities within the South Atlantic Division. As always, the last time I was in here, I'm still just as nervous, even over the telephone. But just to give you just to answer some of the questions, what encouraged me to get where I am is I started off I didn't even start off in this field. I started off in computer engineering. And from computer engineering, during the summertime, I worked at a hospital and found health information management. And I've been in love with it for the past 20 years. So it has brought me to where I am now. And with that, over the past 6 years, I have been in the trauma world from a coding aspect. So in addition to medical coding, it also can kind of branch out into specialty type of coding. So what I do on a full-time basis is what is known as trauma coding. And I've been doing that for the past 6 years. And that just, what we do is analyze patients who would meet a trauma criteria, meaning fractures, dissections, any type of traumatic injury, basically is what I track. In addition to that, part-time, I teach adjunct coding. And that is a different world. That is me preparing students into the world of medical coding, no matter what specialty you get into. And it's preparing them for what's to come in this world. It is a huge dynamic. And I think it's still, as of late, I feel like it's coming to light and more people are like, oh, what is this medical coding? Oh, I'm familiar with medical coding, opposed to probably 10 years ago, some people might not even really, maybe even a little later, might not even realize what medical coding was. But now we're coming more and more to the light. So I prepare students for that. Like, don't just think, you're going to be in the background. No, you will participate and be involved with your clinicians, and you're involved with that care. So we're coming to the light now, and it's a great thing, and I love it. I love seeing it. You can mention medical coding now, and nurses know what you're talking about. Physicians know what you're talking about. So that's wonderful. I wish I was on camera. It's so exciting to hear and see and witness and be a part of, actually. Trying to think of what else. My typical workday is, honestly speaking, is just chaotic, as if you were being on the clinical side. I'm on the non-clinical side of it, but probably dealing with just as much, except if not patient care. I'm reviewing all of you all's documents for treating your patients. So with that, I'm managing just like the physicians and the nurses and the unit clerks and the CNAs, LPNs, all of them. I'm dealing on a daily basis various personalities all day long. In addition to that, what I do now, because I'm in a lead position, it's kind of, I've transitioned into more educating. So I will review on a daily, I review medical codes for their errors. And then I go back and I educate all the analysts on their mistakes, on saying, okay, this is why you should not code this to this. This is, and why this diagnosis doesn't match what actually happened to the patient. So now I'm more on the educating side. So I'm educating on both worlds now, which is awesome. It's a great experience. As far as the future of healthcare, from a medical coding standpoint, coding is going nowhere. It is not going anywhere. It is still in high demand. Even with a lot of coders are now going remote, but even then, we're still not going anywhere. Even with technology changing year to year, it's benefiting us and it's assisting us, but it's not. We're still here. You're still going to need your coders. In addition, with ICD 11 finally coming to the states, the United States, we're definitely not going anywhere because we're here. We're here to stay, and we're not going anywhere. And we're here to bug you all to make sure all your documentation is okay and ready for us to code properly, so we don't have to bug you all and your bills can be correct. But that is the medical coding world in a nutshell. From the bottom of my heart, I give my sincerest apology, because I am so up to date when it comes to my tech and my technology, and I'm usually the first one on a WebEx or any type of meeting, and I wholeheartedly apologize. But I would like to end with 2 quotes that I look at every single day, because like I told you all, I love, love, love what I do. And if it doesn't challenge you, it doesn't change you. And every day I am challenged and I learn something new. Also, people with great passion can make the impossible happen. And even when you don't realize it, it happens. So with that, I thank you. I thank you for inviting me to be a part of this. And hopefully I didn't go over my 15 minutes. Are there any questions?
You were perfect. We're going to take questions now for Professor Harris. So if you have any questions, please type them in the chat box and I'll read them out to her. So I'll give y'all just a quick second to type up your questions so we can continue on. And you didn't go over your time, so you're good, Professor Harris.
Okay, thank you.
I'll ask one question. Oh, actually, here come the questions now.
Okay.
What made you choose the career in coding?
Okay. That, I stumbled upon it by accident. Like I said, I started off in computer engineering. I worked at a hospital they had a college program, and they had college students come in the summertime, and they put me in the health information management department, and I've been doing it since, and I've been here for 20 years. I've done pretty much, I'm still working my way up, because you can branch health information management all across, like into different variants. But as far as medical coding, I was still in health information management, but I was looking for something just a little bit, again, to challenge myself, just a little bit more different. And honestly speaking, I knew my worth and I knew my potential, and I wanted to grow. I do not want to stay stagnant. I'm not that person. I love taking what I've learned and taking it and moving it forward. And that's what I did. And luckily I landed into a position, and it was dealing with trauma coding. And I was like, let's go. And here I am. And I've been running with it since, and I'm excelling. So that's what made me do it. It's just challenging myself and trying to grow and seeing what else is out there and what pathways I can go within this field. But I don't think I'm leaving trauma. I love trauma because it's interesting, and everything you watch on TV, I'm coding it. So I don't think I'm going anywhere. Any more questions?
We have one question in the Q&A box that asks, what is coding and how do I learn medical coding?
Medical coding is taking alphanumeric codes that has been generated by the organization called WHO, and they're alphanumeric codes that code medical diagnosis. So if a patient comes in and says, and you diagnose this patient with hypertension, diabetes, congestive heart failure, on the back end, there are medical codes that are associated with every single diagnosis. There are over 70,000 codes, I believe. Don't quote me on that number. I used to be able to tell you that right off rip. But so that is what coding is. Coding is putting these alphanumeric characters with attached to a medical diagnosis. And how to get into it. First thing you would do, there's different pathways. You can get a certificate in it, your associates in it, your bachelor's, and so on and so forth. To start off, I know for a fact, this isn't a plug, but most technical colleges will offer, you would check with your technical colleges if you are looking just for a certification, excuse me, in it, and you will look for medical coding and billing. If you're going for your associates or your bachelor's or so on, then you would look for a college or university and health information technology or management. And that's a whole far as medical coding. It will fall up under medical records, revenue, benchmark reports, all of that. But if you're wanting to just kind of strictly stick to medical coding, I would say start off with your certificate, because then you'll know whether or not that is something that you want to do.
We have a few more questions. Someone asked,
Sure.
What programming language do you use? Do you use C++ or is it a specific software you go to?
So C++, oh, you bringing out my computer engineering. C++ is more computer coding. Medical coding it will take numbers in the alphabet and kind of merge them together. So it's no specific system. It's kind of generated through an organization, and they can get updated or changed through yearly. But far as if I'm understanding your question correctly, don't compare it to a computer program, because it's not. That's more working in the background. Far as the software, there are a multitude of medical coding software that will help you code something. But far as and 3M is one of them, Optimum is one of them. And what that does is, for an example, using 3M, it's a medical coding software. And what we would do is, I can put in a diagnosis and say hypertension. And then it's going to ask me questions. The medical software is an electronic form of the actual medical coding books. So instead of you using the book, coders use the software to avoid having, it's basically just taking away the time to actually look through the book, opposed to going to your index, looking up a diagnosis, then going to your tabular, and then looking and then going to that code in your tabular. I can go into a medical coding software program and put in hypertension, and it's going to take me directly to that code. Or I can put in syncope, and it's going to take me directly to that code. So don't look at it from a computer coding side of it.
We have two more questions. I'm going to
Sure.
sort of tweak these last two. So part of one question states, do medical coders work from home? And then the second question was, do you prefer working from home with your career, or do you prefer going out to work?
Okay. Since the pandemic, it has changed tremendously. First part of the question, as far as working from home and how to work from home. Now, a lot of coding positions will more than likely say the percentage is now higher where when you apply, it's going to say this is a remote position. Previously, it was hit or miss, and it was due to experience. If you have anywhere between three to 5 years or more experience, you have a higher chance of getting a remote position than you would coming in as entry level. That has changed since the pandemic, where now if you go to apply for a job, regardless of your years of experience, you will, it's a high chance now it's going to stay remote. For me personally, when it comes to working from home or being at a facility or at a site, I have my days because I did not always work from home. I worked in the facility, and I miss the interaction with my team. I miss being able to go to Dr. such and such and say, can you take a look at this? I'm not really sure if this is documented correctly, opposed to now having to send an email and say that, or if because I have a relationship with the doctor, I can text them and say, hey, can you look at this patient? But honestly speaking from my heart, yes, I do miss working on site. It's definitely convenient. Working from home is the convenience of being able to throw a load of laundry in while you're still working, opposed to having to wait till you get home or doing it when you first walk in or before you leave the house. Because other than that, I am working all day. I am at my computer all day. I'm still getting up and acting as if I was getting ready to leave the home, but I still have that little convenience. I can just get up and walk and do whatever it is that I may need to do in the house, opposed to waiting to get home. But I think I really do miss working on site, just because I miss the camaraderie and the team dynamic right there in your face, opposed to just virtually. I'm not against either or, but just me, I just miss it because I didn't sit in a cubicle all day and not be around people. I was anywhere from my partner or my coworker all the way up to C-suite. So I walked up, I was in C-suite, I see my CFOs, I see my CEOs, and we can converse and have a conversation and say anything work related to, oh my gosh, did you see that game last night? So I do miss it. Any more questions?
Oh, all righty. Thank you so much. No, that's all the questions for you.
Okay.
We thank you so much for coming on this morning. And could you, is there any way that you could put your email address in the chat box? So if students have additional questions, they could email you.
I sure will. I will. Right. I will do that. I'm going to hang up and see if I can log back on and jump in the chat and then come back off. Because like I said, I was having a bad day. I'm sorry, guys, but I will absolutely do that for you all. Thank you so much.
Okay, thank you. Thank you. You take care. Next, we're going to hear from Dr. Deborah Reed from the Physician Assistant Program at Orangeburg Technical College.
I'm unmuted. You can't, so I'll just talk through. Can you see me?
Yes, we can.
Yeah. Oh, you can't see me. Oh, okay. I very well. Good morning. Thank you so much for inviting me to this career symposium. I feel very appreciative of having the opportunity to share what I do for a living, and just hope maybe I can inspire someone to join us and have some more PAs coming along. So I'm Deborah Reed. I am a physician assistant, and I've been a PA a very long time. This is my 37th year, so been a PA a long time. And I just wanted to, I thought the way I would do my presentation is kind of give a little background on the PA profession, and then from there, give you an opportunity to share my personal experience. So I titled my talk, The What, Why, and Where. Why become a PA? What is a PA? What is our typical day like? And what is the future for PAs going forward? When I became a PA in 1984, no one knew what a PA was. You know, everyone asked me, oh, what is that? And so I always found myself having to explain exactly, you know, what a PA was and what we did and our contribution to healthcare. I can say now, I'm very proud to say that the career has just blossomed and grown, and you see PAs everywhere, and so I'm very proud to be a PA. Next slide. Okay. So what is a physician assistant? Basically, PAs are, as I'm sure everyone's pretty well knows, this point has interacted with a PA, are medical professionals who are trained to diagnose, to treat, to manage treatment plans for patients, can serve as a primary care provider. We have prescriptive privileges, so we're able to write prescriptions. Our training is very intense. Most programs are 28 plus months in-person training, schooling. So basically you get your bachelor's degree, you apply to a PA program, which is a master's level, take the GRE, and you get accepted into a program. And it's well, I remember my program being 28 months straight. We maybe would get maybe a 2 or 3 week break, and then we were back in the classroom again. PAs now practice in every state and in every medical setting you can think of. And they also specialize. There are post-residency programs. If you have a love or preference, you can, you know, kind of specialize in that area, and that can kind of dominate your practice going forward. Next slide. I'm sorry, I can't share my own slides. Thank you. So the profession at a glance, the history of a PA. The PA profession was established in 1967. The first class graduated from Duke University here in North Carolina. I reside in North Carolina, by the way. Presently, there are approximately 150,000 PAs practicing throughout the country, District of Columbia, all US territories, and also uniformed services. There are approximately 277 PA programs throughout the country, and that number is growing. And it is a master's level degree. Well, I'll talk about this a little later. Once you graduate from an accredited program, you have to pass a national board certification. And that board certification is mandatory by the state. So you have, in order to maintain your state license, you have to be board certified. When I first graduated, you could be board eligible, meaning that you graduated from an accredited program, but you may not have sat for your boards. You may not have successfully passed your boards. You could still get a license. Now you must be board certified. And we have to research, we have to take our boards every 10 years, like the doctors. So the AMA, the American Medical Association, basically manages the PA profession. We work up under the licensure of a physician, and we sort of follow their model. So they take boards every 10 years. The PAs have to take boards every 10 years. The nurse practitioners, in contrast, they take a board, they graduate, they take their boards one time and they're done. They don't have to re-board. But that's something that they require for the PAs. We also must maintain 100 hours of continuing medical education, meaning we have to attend a conference, we have to do some journal reading or something to keep up, and we have to submit it to the National Academy of PAs to maintain our certification. So it's not just passing your exam every 10 years, it's actively staying in an educational environment where you're learning and you're keeping up and able to practice evidence-based medicine, because that's basically what medicine is these days. Next slide, please. So why become a PA? You know, if you want to practice medicine and you want to diagnose and treat and prescribe, why not go to medical school? So next slide, please. That was my dilemma. I actually went to college as a pre-med major. Back in my day, back in the day when I went to college, we did have pre-med was a major, pre-medicine studies. Nowadays, I know I have 3 daughters who just finished college. I think they do you have to pick either health professions, it's different. They don't have that pre-med, or maybe it's not at all universities, but it was geared towards preparing you for medical school. And so that was a program. I always wanted to be a pediatrician all my life. When I was a little girl, I was going to be a pediatrician. I used to doctor on my dolls, and that was my dream. And that's what I thought I went to college to do. And my third year, my junior year, I got sick with the flu, and our school was closed. The student health center was closed. And I ended up going to a local doctor's office. I had the flu, and a PA student came in to examine me. I'd never heard of a PA, didn't know what a PA was. And she did everything the doctor did. You know, she examined me. And of course, she was a student. So the doctor came in after her to follow up with me. But I was just enthralled, like, what are you doing? And who are you? And what do you do? And so she was a student at Stony Brook in New York. And she told me that she would send me the information. And back then, like I said, although the profession has existed since 1967, in the 80s, people didn't really know what PAs were, including myself. So she sent me all this information. And I'm like, wow, oh, I could do this. You know, it wouldn't take as long of study. I could have work, you know, I could get married and have children and faster, you know, that kind of thing. So that was where I was. I will be honest and transparent with you today and tell you it's a regret that I have. I took MCATs. They advised us in our pre-med program to do our MCATs just to kind of try it out and see. Unprepared, no, you know, special, what do we do? Like the training to take exams. And we just take it cold and just see where you are. And of course, if you're unprepared for a test like that, you're not going to do well. And I did not do well. And what that did was deflated my confidence. And so I just want to say to anyone listening, thinking about practice of medicine, I encourage you to really consider medical school too. You know, I love what I do as a PA, but you work very hard. You're going to study hard. And if you really want to do it, you can do med school too. So I just want to throw that out there. Why come become a PA? There's work-life balance. You don't have, you know, you work with a physician, it's collaborative. You don't have the ultimate responsibility of everything. In some settings you will, but for the most part not. It is a competitive salary. I think most PAs just starting, coming out of school, they may start at like $90,000 a year. So it's a great starting salary. You will have student loan debt or student loan, so kind of like that. The median salary for PAs, they're saying, is $105,000, and that goes up with your years of experience, depending on what branch of medicine you're working or where you're working, the setting, and so that can change. The length of school is less than medical school. Medical school is 4 years post-college. PA school is a little under 3 years post-college. And then you also have to do a mandatory residency after med school. With PAs, you can come out and start practicing. Of course, like I said, if you want to specialize in pediatrics or ortho, I think there's a hospitalist residency now, there's emergency medicine residency. You can do a residency if you want to specialize. And the specialized PAs, they do very well financially. So if it's something you absolutely are passionate about, I have spent my entire career in internal medicine. I've worked in an office. I've spent the bulk of my career in the hospital setting and a hospitalist team. And the last 15 years, I've been kind of doing a hybrid hospital, and I'm doing long-term care in nursing homes. So I work because I love geriatric patients. I love patients with dementia. It's my thing. My passion. And so that's what I do every day. What's nice about being a PA, though, is that you do get to really focus in on the patient. You have a little bit more time. If you know your doctor's office, it's about fee for service. And as Professor Harris just talked about, that coding, getting that billing in, that's really, really key. A lot of pressure to see more volume. So I do find the PAs have a little more liberty to kind of spend more time with their patients. And you do work with all disciplines in medicine. You work with your therapy team, the social worker, the medical social worker, all branches you interact with. So that would be, great. And then of course, your continuing medical education, and there is job security. So, okay, next slide. The steps to becoming a PA, of course, you have to complete all your prerequisites. So depending on your program, you have to look at the PA program that you want to apply to. Generally, it's going to be a very heavily science-based college curriculum. So meaning you're going to need to do your anatomy with lab, your chemistries with lab, organic chem with labs, biochem with lab. So it's very, very science-based. They're going to look at that. They're also going to look at versatility, well-roundedness. What other things have you done? Are you going to be able to juggle the two? So it's that. Then of course you attend an accredited PA program. Make sure your program has passed all the accreditation of the National Certifying Commission on Certifying Physician Assistants, that it's been accredited by the NCCPA. And then once you graduate, you're going to take your boards. You're going to be successful. You're going to become certified. You're going to obtain your state license wherever you choose to work. And then you must keep that license in good standing, meaning you follow the laws of prescriptive rights. You keep up your CME. You don't do anything to your patient, first no harm, and always stay in good standing. Next slide, please. So PAs work in various places. You have PAs in the hospital, urgent care centers, outpatient offices or clinics, long-term care facilities like where I work. There's PACE programs. You just think wherever medical healthcare is being delivered, you may have a PA in the midst. PAs tend to primarily work in primary care, that we're basically considered primary care providers, but it's at primary care, it's internal medicine, which is mine, and internal medicine branches off to very geriatrics, pediatrics, things like that. Emergency medicine, if you like that fast pace, ERs love to have PAs. Across pediatric surgery, different branches of surgery, ortho, neurovascular, the different branches of surgical options, PAs are there as well. Family medicine, and again, there's just a mirage of other places in healthcare settings where PAs work. Next slide, please. So this year, for the very, I don't know if it was the first time, someone told me it wasn't our first time, but in the US News and Job Reports, PA, the physician assistant, was the #1 profession in healthcare to have. It was the #1 ranked of the best jobs in healthcare. Previously, I think we were 3 for a while, but this is the first, I thought this is the first time we've ever become, we were #1. But so PAs are becoming very popular. It's competitive to get into the programs. So you want to do very well in college, keep your grades up, especially in your science courses, and try to be well-rounded and really put forth a great application. Minorities too, I would love to see more minority students apply to PA school. I think minorities, if 5% of the PA workforce are minorities. So I would love to see more minority students in these PA programs. Next slide. So the future of the PA, according to the Federal Bureau of Labor Statistics, PA employment is expected to rise by 31% over the next 10 years. We continue to be very, very crucial in improving access to quality health care. We help to fill the gaps of where you may have people with less ability to have access to health care, especially in the aging population. Patients are growing older, they're living longer with more complex medical conditions. They need providers to help care for them. We played a critical role during, of course, this pandemic. I personally do long-term care, and we did, when COVID first hit last year, we had a nursing home where we lost almost about 50 of our patients. I think our population was only 80. So I was first, front line with the COVID pandemic, and it was scary. I was very sad, and it was tough. We just recently had another with the Delta virus. I think my facility we had 14 cases. Was an unvaccinated employee that was working, and we had 14 patients, but they all survived because they were vaccinated. So it wasn't as sad as last year. So we're learning how to do it a little bit better, but definitely played a crucial role in this. And so we're collaborative. PAs are trained for leadership as well to do some advocacy things. And one of the most critical things that are happening is that PA, the name physician assistant, they're now trying to litigate to try to change the name to physician associate. So that's the newest thing. So you might start hearing that in the future. And also for us to be able to work independently, not under the license of a physician. Next slide. I know time is winding up, so I just want to be available for questions. So that's it. Thank you so much for your kind attention, and wishing you all much success in whatever career path you choose. You will definitely make a difference. And my email is here, debreedpa@gmail.com. If you have any questions, please feel free to contact me. Thank you.
We have a few questions in the question and answer box. One has several parts. One is, can a PA do surgery? And how many hours does a physician's assistant work?
Okay. Absolutely. If you are surgical PA trained, and there are residency programs for that, it also depends on the surgeon you're working with, their level of trust. A lot of times in ortho cases, the orthopedist might be in there and open and start the case, and many times the PAs are closing them. So meaning that they're the ones that's, suturing and closing and getting, finishing it off, and the orthopedist has already left the room. So absolutely, it depends on your level of training and the relationship you have with your surgeon. And PAs can work very long hours. I myself, I work very long hours just because I'm in a nursing home setting, things are constantly happening. I find the younger PAs are much better with boundaries and keeping their schedule and, staying on task and getting things done. But it can be long hours. It depends on your setting. If you're in a hospitalist, you may have a bad day. You get a bad patient that ties you up, that's it. And it's not a 9 to 5 that you can say, oh, it's 5 o'clock, I gotta go. Now that patient's not doing well. So it is hardworking, but it's very rewarding, very rewarding. You feel good when you see someone doing better and you had a part in that. Any other questions?
We have a few in the chat box. One is, what did you do in college in order to stay financially stable? And were you all in the medical field? I believe you might have answered.
Okay, so financially stable. I was a young PA, so I was still living at home when I went to school. And so that was an advantage for me. And my program, I went to the City University, Sophie Davis School of Biomedical Education. It's in collaboration with City University of New York and Columbia University. And I'm from New York, I lived in the Bronx, so I was able to commute from home. So I didn't have that overhead. And it's very difficult to work when you're in PA school. So a lot of the younger students, I do precept as well. They do talk about their student loan and the programs being so expensive now. So that's something they need to, that's a challenge that I did not face. I guess I was fortunate in that way. Because it's going to be very difficult I don't think any of my classmates, and I think in my class of 22, 5 went back to medical school and became doctors. I took a different path to my doctorate. But they went back and got their medical degree, MDs.
Okay, so Dr. Reed, do you mind answering the remaining questions in the chat box?
Okay, sure. So I just go into the chat box and answer them? Okay.
Yes, ma'am.
Okay.
So we are going to move on to our next presenter. I'd like to introduce, thank you so much, Professor Jackson, a nursing instructor with Denmark Technical College.
Right. Good afternoon, everyone. Okay. Let's see if I can. Okay. I am Adrienne Jackson. I am a PN professor here at Denmark Technical College, and I'm going to be your personal tour guide through the world of nursing. I have been a RN for about going on 10 years. I've worked in multiple areas of nursing, and my favorite thing has always been to not only educate my patients, but also educate the new nurses that are coming on board. It's very important for the older nurses to come in and kind of mold the newer ones and help them with those skills that they've just learned. So that's always been my favorite thing to do. I'm a new professor to the field, to the teaching field as far as that. So we'll get started here. I want to start off with the definition of nursing. Now, this definition of nursing comes from the International Council of Nursing. And I wanted to start here because many people are unaware of what nurses really and truly do. We do more than just pass medication and attach people to IVs and cause pain. Our job is to really provide holistic care to our patients, as well as good patient education. We want to make sure that our patients are not only receiving great treatment, but also getting enough knowledge about their own disease process so that they can properly manage them at home, okay? So there are multiple levels of nursing, and each level could be reached by receiving different education. So certified nursing assistant, most people call them a CNA. They come in and they provide basic care, and that'll be bed baths, taking vitals, and they really are a integrate piece to the collaborative team because the certified nursing assistant looks at the patient a little more than the rest of the team. So I always tell my students as well as new grads, hey, your CNA is your friend. They are keeping eyes on your patient when you're not there. So make sure you work well with them. Your licensed practical nurse, you'll receive that education if you were to attend receive an associate's degree in licensed practical nursing. And you also can receive a registered nurse, that'll be an ADN degree within that, and that as well is an associate degree, I'm sorry. The BSN is the Bachelor's of Science of Nursing. And the only difference between the ADN and the BSN is the BSN is trained to perform different research, as well as they're receiving knowledge on theory. Okay, now I believe Dr. Reed mentioned that earlier about evidence-based practice. That is where the BSN degree steps in at. They will conduct a lot of those evidence practice projects, as well as collaborate with others on the healthcare team. Advanced practice nurses, they are nurse practitioners. You'll see most of them are APRNs. They can specialize in different areas. You'll normally see the family nurse practitioner, acute care, and that's the APRN. You also will see the gerontology specialization. And also one of my faves is the certified nurse anesthetist. A lot of the nurse anesthetists that I've met during my time in the field have been absolutely awesome. The work they do has been outstanding as well. And they get a lot of good hands-on treatment, hands-on knowledge, excuse me, because they come from critical care. Critical care nurses, they get a general base knowledge of all of those things you'll see in the medical field, but they really, really get a good idea of emergency situations. How to become a nurse. So here I have general requirements for Denmark Technical College's nursing program. Of course, you will apply to the university as well as the actual nursing program. There's also, here we have an entrance exam. Some schools have stopped with the entrance exam. It used to be the TEAS exam. Now they're using the Kaplan entrance exam, and that exam covers basic information, reading, writing, things like that. You want to make sure that you have a criminal background check on file, or make sure you arrange one with the university. They also do drug screening. And once you get in the actual program, you'll also receive the proper immunizations you will need to go out in the clinical setting. The only difference from our list of requirements would probably be that entrance exam and the requirement for GPA. The GPA requirement for each university is a little different. We would like to see most of the nursing students that take that entrance exam make 60% or higher before entering the program. So pros and cons of nursing. These are some of the general pros and cons that most nurses in the field will complain about. The pros of our field is that it's very rewarding, because a lot of the times we start the treatment and we're also the ones that are there at the end. So we get to see the whole process from the beginning to the end, and that's personal satisfaction for you, because you feel like all of that hard work you've put in to that patient's care has done some good, because you're gonna see a lot of patients that may not get better, okay? The flexibility of our schedules. You can work a 12-hour shift, which most nurses do 3 days. So they'll do 36 hours in total. And that's if you're working in like a hospital facility. You also, if you're working in long-term care, sometimes they'll do 7 on and 7 off. A lot of nurses like that, they're working 1 week and then they're off the next. And if you're in primary care, you would do those 5 days. You're off for weekends and holidays, and it's usually 8 to 5 or 9 to 5. Nursing jobs are everywhere because people are sick all the time. So that's another great thing about the nursing field. You'll always have job security. You'll always have different opportunities presented to you. And one thing, and the last thing for the pros, you'll always be a trusted professional in the medical field. People always look to their nurse to tell them, you know, is this the correct move? Or can you tell me if the doctor is doing what they need to do? But that's all because one of the bases of our profession is to be our patient's advocate, okay? So being that patient's advocate, the patients trust the nurses a little more because that's our job, to stand up for them on the patient's treatment. And whatever procedures that the doctors will put in place, although the physicians will take that time to explain those procedures, they also look at the nurses for different answers and just that self-assurance. Cons, you're gonna work a lot, a whole lot. Nurses are very busy. I know everyone has the misconception that nurses make a lot of money, but to tell you the truth, nurses usually work a lot. Not saying that the benefits aren't good, but we usually work a lot. And piggyback into the physical demand of nursing. You're going to be standing a lot. You're going to be walking. You're going to be running. So it is a lot of physical demand in our field. What I get from my students a lot is that the programs are very difficult. Yes, nursing school is hard. I tell my students that it's basically mini medical school. You're learning all of this information that in pieces that you'll have to put together in the end for it to make sense so that you can safely practice. So yes, all of the nursing programs will be difficult. So these are just some general areas of nursing. I think a lot of times when people talk about nursing, they only put us in the hospital or in a long-term care facility or in a doctor's office. But now you can work in multiple areas. There's also legal nurse consulting where they will have a RN or a nurse practitioner work with an actual lawyer, a law firm, and sometimes they have legal nurse consultants placed in hospital facilities to help with certain cases, difficult cases. And those legal nurse consultants are what we call the prudent nurse. And that prudent nurse, she follows all the rules. She knows the rules. She's good at what she does. And she will be brought in to review the case, look at the different nursing notes, different physician notes, scans, all of those things. There's also corporate nursing, where they work in the administration part of nursing, kind of generating different protocols, cascades, things of that nature. And nurses also do billing and coding, which is very interesting, very interesting. They come in and they, because we understand what we need to document in our notes, to get to receive Medicaid and Medicare billing or from other insurance agencies, nurses do a good job at coding and billing because they can point out those mistakes once they've received that extra education on coding and billing. So some nursing tips. These are some of the tips I give my new grads and some of my nursing students. I always encourage them to be a lifelong learner. The medical field changes all the time. And I have told them I've been in nursing close to 10 years and I learn something new all the time. So you want to be open to change and you want to be open to continuous learning, okay? And I also tell them too, when there's new protocols that come into place or a disease process that you haven't seen before, go back, hit the books, because in order for you to provide the proper treatment and care for your patient, you want to be knowledgeable about what you're doing. Always evaluate your mental health. Very, 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 very important, okay? As nurses, we see a lot, whether it's from a trauma patient or seeing someone with the same disease process as a family member, or working in certain areas of nursing like psychiatric nursing or in certain trauma areas, as well as oncology. Okay? It's always good to evaluate your mental health so that you can make sure that you're mentally healthy enough to provide great treatment for your patients. And that way you can always get a positive outcome. Critical thinking is key. I always ask my students why. Why? After they've received that knowledge, I've always asked them why, because being able to critically think as a nurse is very, very important in all areas of nursing. You're the physician's right hand, or advanced practice nurse, you're their right hand, okay? So you wanna be making sure that you're preventing any detrimental outcomes before they even start. I always tell my students, let's stop the boulder before it starts to roll down, because it's always more difficult to stop it once it's in motion. All right, any questions for me?
Yes, there are some in the chat box. 2 questions. What is the average salary for a PN, and were you always interested in the medical field?
The average salary for a PN, I think it depends on what area you're in and how much experience you have. I usually see anywhere around 23 an hour for PNs. Have I always been interested in the medical field? Yes. I actually started out pre-med as well. My first degree is in microbiology with a concentration in biomedicine. And I actually did some breast cancer research. So I had all intentions of going to medical school, but I was placed on a waiting list. So while being on the waiting list, randomly ran into a director of a nursing program, and randomly had a conversation with her. And she said, you know what, you should really apply to be a nurse. And I'm like, I don't know. But I went to her office, I still met with her. And that's how I kind of fell into the nursing field. But I've always had an interest in the medical field.
Right, and a few more questions. How was school for
Whitney,
you, and did you pass the NCLEX exam the first time?
Could
I
you
didn't hear the first part of.
Oh, I'm sorry. Could you answer those in the chat box for the students who have additional questions? Can you see the questions in the chat box, Ms. Jackson?
I can see them now. Okay.
All right. Okay. Could you answer the rest of those questions in the chat box so we could go ahead and introduce the next speaker?
Oh, I'm so sorry. Okay.
Oh, no, you're fine. Thank you so much. Thank you so much for your time this morning.
Oh, no problem. Okay,
All right. Next, we're going to hear from Marian Mathis, a physician assistant student with the Medical University of South Carolina.
All right. Hey, you guys. So just a full disclosure, I'm lucky and have construction going on beside me in the next house. So no one's trying to break in while I'm doing this. So I'm gonna try to make it a little bit quick. So I am a second semester PA student at MUSC. I graduated from Francis Marion University in Florence in 2014, and I had a degree in sociology. So when I started out from undergrad, I actually became a social worker for the Department of Social Services. And so while I was an investigator, we had like a lot of like critically ill patients. And so I was constantly coming down to MUSC, and I was working, like I would have to like listen in on like the different rounds that the PAs and the doctors were doing. And I was like, oh, this sounds a lot more fun than what I'm doing on this side. So I was like, I think that I want to be more proactive than reactive. For anyone that's considering social work, it was very high stress and just something that I just really emotionally like couldn't handle. So I decided to switch paths, and I started doing, getting my prerequisites for PA school, as I did not do any sciences when I was in undergrad. So I worked for 5 years in clinical experience, and also did like my prereqs part-time. So one of like the scariest things about applying to PA school and going to PA school for me was the financial aspect of it. And thankfully, Dr. Reed covered a lot of stuff, so I don't even have to get into a lot of the details of being what a PA is. But as far as financially, I was like, I just don't know how I cannot work and go to school. But thankfully, when you do apply to PA school and you get in, they actually set up a lot of different, like they help you with loans and everything. And then also with your loans, they actually account for how much it costs to live, how much your books would be, how much your equipment is going to be. And so you're not really, my only income is my student loans. And because I can't work, it just ends up working out as a blessing. So as a PA student, I feel like I'm working. I treat it like a full-time job. So I'm in class from 8 a.m. to probably like 3 p.m. Thankfully with COVID right now, we can Zoom from home as an option. But I actually prefer to be in person, but today I was like, I'm going to come home and listen to this construction for you guys. And so we probably have like 5 classes a day. And it's very, very fast paced. And so after I'm done with my classes, I usually am just studying until 5:30 or 6 o'clock. And then after 6 o'clock, I take a lot of downtime, just because they really do stress as far as the mental health aspect of it. And then we also have a lot of hands-on things. So we do have like a lot of labs where our classmates are our partners. And then let's see what else I got for y'all. So then as far as your PA requirements, the application requirements, every school is different. So at MUSC, they required like different clinical hours and things of that nature. So for me, because I didn't have like a normal path of going and getting a bachelor's degree in science and then just hopping into applying for a PA school, I actually just worked in the clinical setting. So I worked in the ER, I worked in the OBGYN, and I also worked like in primary care, whether it was as a medical assistant or a scribe, just to get my experience. So honestly, I always told my employers, like, y'all are giving me a free education because I was getting paid, but I also was learning in the process. And you have to use those clinical hours for your application anyway. So I was just killing 2 birds with 1 stone and being able to pay my rent at the same time, which is really good. And then as far as wanting to be a PA, I really like the team aspect. I just don't think anybody wants to work alone. I mean, some people do, but that just wasn't for me. So definitely having a team aspect and knowing like, yes, I'm going to be doing patient care, but I'm also always going to have somebody that I can go to and be like, hey, I need help with this. And so, I mean, the PA right now is the #1 job, like Dr. Reed said. So that's really attractive for me. And thankfully, as far as I'm investing, and let's see. Oh, I saw, okay. And I was trying to, let's see, some other things. I think that with PA school, if you are considering it, I definitely recommend finding out now what your study habits are and also learning ways to manage your time. Because when you get in PA school, I've noticed like some of my other classmates, it's almost like a shock, like, wait, like how am I going to manage my time? That would be the biggest thing. And I think that like if you like for associate's degree, if you're currently like working towards an associate's degree, they do have programs. And I think that in a few weeks, they're going to talk about MUSC has a bachelor's program that you can actually transfer from associates. And then it's an online bachelor's program, and then just to go into applying for PA school. So even if you feel like right now, like, oh, I don't know, like whatever your path is, everyone has a different path in PA school. That's what I like about it. Nobody's done the same thing. Nobody has the same clinical hours. And everybody is just such different personalities and experiences that when you get in and you have your classmates, you're just constantly learning and growing from everybody. Any questions, guys?
You can either write your questions in the chat box or in the Q&A box.
I saw
someone just asked, are you enrolled in MUSC right now?
Yes, I am. I'm almost through my 2nd semester. And so yeah, currently in MUSC. I live downtown Charleston, just a walking distance from MUSC, just to limit on time. And it is a lot of material for sure to get through, but if I can do it, anybody can do it.
I guess another question that may be important, how has COVID changed your experience as a PA student?
Oh, okay. So I was very terrified of going into PA school with COVID because I am very much hands-on and in the moment learner. We do have an option to Zoom. However, they offer a classroom experience. We do have to wear a mask, which was kind of odd because you're going into PA school and you can't even see like your classmates' faces. They do record a lot of the lectures just in case, and they like recommend us to be safe as far as like COVID precautions. But yeah, we are able to be in the classroom and Zoom right now, but who knows like if they'll be able to do that. And then, what jobs am I doing in college to help financially? So I do not work, I'm unemployed. And I just, so with our student loans, when you apply for student loans, you get a bulk amount at the beginning of the semester, and then you just have to budget it out. And if you don't budget it out, I don't know what's going to happen. But yeah, so you are not, I think that you can request to work. However, I don't think that I could work in PA school. There's just no way I would ever have the time to do that.
All right, thank you so much. We are going to move.
Whitney, you're muted. You're muted, Whitney.
Thank you. I'm sorry about that. Thank you so much for your time. We are going to move on to our last presenter, Dr. Oliati. He works within internal medicine with MUSC Health Lancaster Medical Center. Can you hear us, Dr. Oliati?
He's muted. Oh, there you go.
Sorry, guys. I had to relocate from my previous location. Hi, everyone. I'm Fatai Oliati. I'm a hospitalist here at MUSC Lancaster. I'm happy to join everyone here today.
All right, you can begin with giving us a background about your profession and what got you started, and then at the end we'll ask a Q&A.
Very well. So I'm originally from Nigeria. I probably would say that I grew up in a family with a couple physicians, and it just kind of felt it was an ideal thing to do. It was an honorable thing to do, to go into that kind of profession, because you saw people who over and over again had to sacrifice their own comfort, their own time with their most beloved, and time around family mostly, to care for other people. I thought there was no better way to find satisfaction in a career than that, at least for me. And that's one of the main reasons why I decided to pursue medicine. And I like to say specifically that because you kind of came from that kind of a family, it doesn't necessarily mean you have to do the same thing that everybody else did. But if you have the same conviction that they do to care for other people, I think it's always very, encouraging to see other people who might have done it and you just go in the same direction. So that was my background. But then I struggled to be able to get into medical school eventually, and, did other undergrad programs, because in Nigeria, medical school is something you kind of went to directly after high school, and it took probably about 6-7 years to be able to finish. But in my situation, I did an undergrad for 4 or 5 years, and then worked a little bit. Eventually, was able to get into medical school in the Caribbean. That was very far from home. I'd lived in England just prior to that, and still it was very far from home, and you had to just buckle down and do what you had to do. So I finished medical school in the Caribbean in 2015, and then went to New York City for residency training. It was about 3 years. Internal medicine, my field of practice, and that takes typically 3 years for training. And after residency, I decided to come down here to the Carolinas to pursue actual working as a hospitalist, and it's been rewarding so far.
Yes, can you tell us about your day-to-day and what do you do within the hospital system?
So being a hospitalist, you're responsible mostly for all of the patients that are admitted to the hospital at any given time. The hospital obviously has different units. The hospitalists tend to just focus on patients that are under the internal medicine, at least internal medicine scope of practice. So you have patients, for example, admitted that are still in the ED. You're talking to them, you're taking care of them while they're there. You have patients that are admitted that are, for example, on the medical floor, in the med-surg floor, and you're there, you're taking care of them as well. You have patients that are admitted to what we call the step down, which is like a bridge between the medical floor and the ICU. You're taking care of patients there as well. And then you also have patients in the ICU. Here now, we have intensivists that are usually responsible for patients in the ICU during the day. But then there are some of the patients that are not as sick, for example, but are still in the ICU for one reason or the other that we still, take care of primarily. So we see patients in all of these floors, and that's kind of what our work is, in addition to obviously taking new admissions as the day progresses. Now, we typically come in about 7 o'clock in the morning. Some of us come a little earlier just so you can settle into getting ready to seeing your patients, reviewing the charts from previous day, reviewing charts of patients that have been recently admitted. And then you eventually have to go and see the patients on your rounds. It might take about 3-4 hours to get through the amount of patients that we see daily. And then in between that, you're making documentations, you're answering phone calls. Nurses are calling you from all of the different floors for several requests, and you're trying to take care of that as you go. And usually after rounds, the majority of what you do is the documentation part of things. In addition to that, you're still getting called for admissions from the ED, and you kind of do that, back and forth till maybe about 5 o'clock. You might be able to sit for a minute, and but at the same time, if you're getting admissions, you just kind of stay in the loop and just see the patients as they come in. And for us, the work is mostly about 12 hours a day.
How has your job changed since COVID?
Well, it's changed dramatically. First of all, I was in New York City when COVID had started, and I used to work in Brooklyn at the time, and it was one of the most devastating experiences for any medical practitioner, the nurses, the healthcare workers in general, especially when you're dealing with something that nobody has a clue of really how to manage effectively. So we went through that completely clueless about what we were doing. At least you just kind of adapted to the situation as we go. And then to a point where we kind of, understand at least a bit of the general approach to managing these patients, still not being able to tell, by any means what patients are going to do okay and what patients are not going to do as well. But now it's pretty much you just do what the regular standard of care is, and you kind of hope for the best, and you just make sure that whatever is within your capacity to fix, you fix that, and then just let the process play out and you intervene in all of the different areas that you can possibly intervene. So it's definitely made the work very, very challenging because you have patients staying longer in the hospital. And then in addition to that, you now start to have patients who might have had COVID with, longer lasting effects, and they're back in the hospital, frequently. You have patients now that, for example, because of COVID, they may not have been able to follow up with their primary care doctors and missed out on their medications and whatnot, and now they end up in the hospital. So I think it's put a big strain on the system in general, and it's something that we hope that at least we can get a good control of, and that's why the recommendation is that whoever is within the age of getting vaccinated should definitely go and get vaccinated. I know there's a lot of controversy out there, unfortunately, but speak to health professionals. Everybody that I know as colleagues has gone vaccinated, and we don't have an extra arm or an extra ear or anything like that. So it's recommended to go and do that, just so all of us can have a better outcome. We either take care of the patient and the patients themselves.
And lastly, I actually received your book. Do you mind talking with them about the book that you wrote?
Okay, all right. Well, so I wrote a book while I was in residency, and the idea behind writing the book was understanding that a healthcare professional is more likely to give the best care that they possibly can if they first of all know themselves. It's what we do in general in healthcare is so challenging that you run the risk of, whether you're in training or you're practicing, you run the risk really of losing yourself in that process, really not knowing what is important to you, what you value, what you put your value on, what is meaningful to you, because the demand of the training is just so much, because obviously it's people's lives and you have to be trained like that. But it's important that everybody in that process takes a step back to really ask themselves, important questions about who they really are. Because once you start to do that, you start to then recognize areas where you can uniquely, with your own unique gift, impact patients positively. And that's really what I was trying to say in that book. Obviously, it was in the form of poetry and prose, but at the end of the day, it was a call for everybody in this profession, everybody in this process, to really pause and figure out what is important to them, not necessarily what's important to the system or what's important to their evaluators or whatever. What is important to you is always the first place to start, and then you can merge, in a larger world in a more meaningful way. And I think that's really what I was trying to say.
All right. Does anyone have any additional questions for Dr. Oliati? I did share the title of your book. I was going to put the Amazon link in there. But
thank you very much. I appreciate that. Thank you.
No problem. Well, if there are no additional questions, thank you, Doctor, for taking time out of your day. Thank you to all the panelists for taking time out of your busy schedules. We really appreciate it. And students, if you have any questions, please reach out to either myself or Jalacy, and we will share the email contacts with you as well. So I am going to turn it over to our director, Paula Jones, for the closing. Then you will be good to go.
Okay, I would like to thank all of our speakers for giving time today and sharing your knowledge about your profession. Students, this is the time to spread your wings and soar with the information you received this morning. Thank you so much to our partners for collaborating in this event. Marlena Gregg from Aiken Technical College, Dr. Minij Shukla from Denmark Technical College, and Dr. Stephanie Brown from Orangeburg Calhoun Technical College. Jalacy Green and Whitney Green, our HCP coordinators. And students, we encourage you to visit South Carolina AHEC's website to review all of the resources that we provide and our web address is scahec.net. One more thing that we would like for you all to do is to take the evaluation for the symposium. Instructions will be emailed to you to tell you how to get to the evaluation part. It's the same AHEC learning portal that you did register. So I will send a link with the instructions on how to complete the evaluation. We really need your feedback. The evaluation code for the evaluation, all caps, B2B2. That's capital B, the number 2, capital B, the number 2. Please fill out the evaluation. Again, thank you everyone for taking a part of this program. Have a great day.